Happy International Women's Day. My name is Dr. Bimpe Lawal. I'm a general practitioner in Peterborough with a special interest in women's health. I'm also the GP lead in respiratory medicine and mental health. I also actively participate in training GP trainees. International Women's Day is an important day of the year where we celebrate women's achievement, where we educate and raise awareness for women equality and call for positive change advancing women. International Women's Day sees a lot of exciting mission which are aimed at raising greater awareness about issues impacting on women's equality, taking stance to call out inequality while working to forge positive action, and also highlighting and applauding women where important gains have been made, and generally appreciate our women all over the world. So these various missions, which include Women Empowerment Mission, Women in Technology Mission, Creative Women Mission, Women's Health Mission, Women in Sport Mission, Women Forging Change Mission. Today I'll be talking more about Women's Health Mission. So Women's Health Mission aim to assist women to be in a position of power to make important, informed decisions about their own health. Women usually put their needs last. As mothers, we tend to put the needs of our family first. So this mission focuses in creating more awareness for women in various aspects of their health. So this includes their cardiovascular health. Women are encouraged to prioritize their health and well-being. Also, it focuses on women's diseases, which include ovarian cancer. This in particular has some atypical symptoms which women are encouraged to be aware of and should be talking to their doctors as soon as they get any of these atypical symptoms, which could include symptoms of bloating, abdominal pain, irregular period. So women are encouraged to be aware of these symptoms. This mission also focuses on removing stigma around some area of women's health, which include sexually transmitted infection, diseases, and also endometriosis is also another important area where women need to be aware of. These tend to be diagnosed about 8 years after the onset of the symptoms. This is mainly because of the stigma around normalizing severe period pain in women. Menopause is another important aspect of women's health, which is not where women used to shy away from discussing. Even healthcare professional is a topic that most people don't want to talk about in public. Interestingly, there are more awareness now, and people are now more confident to talk about their menopausal symptoms in public. We'll be talking more about menopause today, about creating awareness for our women in aspect of menopausal symptoms. Menopause simply means end of period. So this is retrospectively diagnosed 12 months after the period has stopped. So so the the transition of the menopause split into 3 stages. We have the premenopausal period. This is a period where women are actively in reproductive stage. We have the perimenopausal period, and this is a period that spans from the onset of first clinical, biological, or endocrinological symptom up to 12 months after the period have stopped. And we have the postmenopausal period. This is a period where this is the stage where the period has stopped. The age at which menopause occurs depends on various factors. There is the genetic factor. So menopausal onset tend to be linked with age of maternal onset of menopause, or even in siblings, sisters. Biological factor. Studies have shown that women who attain menarche, who start their menstrual period at early age, or who have short period menstrual cycle, tend to attain menopause at an early age. Other factor is diet and lifestyle. Poor nutrition. Women who have poor nutrition tend to attain menopause at an early age. Smoking also tend to cause early menopause. This has been linked with accelerated atresia of the egg oocytes associated with smoking. Poor education has also been linked with early menopause. Studies have shown that women with low level of education tend to attain menopause at early age. This has also been linked with the fact that some of these women with low level of education tend to have poor nutrition or tend to smoke. When we talk about menopause, it's also important that we discuss premature menopause, which is also a very important aspect that affects women's day-to-day life. So this is menopause before the age of 40. This can also be hereditary or be induced from cancer treatment. Menopause can be natural or it can be induced. So menopause can be caused by surgical removal of ovary due to various conditions in the ovary. It could also be iatrogenically caused by ablation of the ovarian activity from treatment such as chemotherapy treatment, radiotherapy treatment, or hormonal treatment. Also, we need to be aware of early menopause, which is a period which is menopause before the age of 45 years. This tends to be linked more with bone symptoms, bone pain, osteoporosis. It's also been linked with, associated with development of cardiovascular disease. There has been studies show that has 53% increase in development of cardiovascular disease with early menopause. It's also linked with early dementia and development of Parkinson's disease. Diagnosing menopause. Perimenopausal and postmenopausal don't require any blood test for diagnosis. The diagnosis is mainly clinical if you have symptoms, which obviously we'll be talking about soon. The onset of these menopausal symptoms also depends on a lot of factors. One of these factors include the lifestyle of people. So with people will smoke, early BMI, caffeine intake, and negative attitude. In Western world, some people have negative attitude to life due to some negative lifestyle, life event changes. Obviously, some of these can affect the onset and the severity of menopausal symptoms. So we're talking about the symptoms of menopause now. The earliest sign of menopausal symptoms is irregular period. It's also important that when we experience irregular period, that we should be talking to our doctors to fully assess us in case there are other possible likely causes of irregular period. Also important to know that even though the perimenopausal period and postmenopausal don't require blood tests for diagnosis, your doctor might also be doing other blood tests to look for other treatable causes of similar symptoms which could present of other conditions which could present with similar symptoms of menopause. So these early symptoms, like I said, are the irregular menstrual period, which obviously could occur, and it could fluctuate in premenopausal stage. Other symptoms, intermediate symptoms that women could have include hot flushes, night sweats, bone pain. Women could have dry skin. Some women have sleep disturbances, insomnia, and some women have problems with their memory issues, and there is a change in fat distribution. Women tend to gain more fat around the waist in menopausal period. So the management of menopause, like I said, it's important that we take care of our health, physical health, important. Management depends on circumstances, age of menopause, and the symptoms. Other symptoms of menopause include the late symptoms of menopause include vaginal dryness. Some women could have symptoms of frequent urination or even a pelvic floor disorder. So management of menopause, it's depend on the circumstances, the age, and the symptoms that women are having. Women with premature menopause should be offered hormonal treatment. This is because premature menopause tend to be associated with other health risks, and so it's important for due to the deficiency, premature estrogen deficiency. So it's important that the doctors will be discussing that with the women. Also, it's important that when we have these symptoms that we should be talking to our doctors. We should be asking questions where we're not clear. We should have clear awareness of these symptoms and take charge of our health. You speak to your practice nurse, speak to your doctor, speak to your pharmacist. When we're managing menopause, it's also very important that we're looking at the kind of ways to manage and reduce cardiovascular risk. Smoking is also one aspect, so it's important. If we smoke, we should be thinking of stopping to smoke. We should try and keep our weight and body fat under check. Reduce saturated fat intake. Regular exercises is important. Women are encouraged to exercise regularly, participate in aerobic exercise or weight-bearing exercises. Also, ensure adequate oral calcium intake. The Department of Health recommends about 700 milligrams per day of calcium. Food rich in phytoestrogens. So phytoestrogens are naturally occurring plant-based compounds that are found in plants, and they have structures similar to estrogen. There are some food that are rich in these phytoestrogens. There are some nuts, lentils, soybean, some clover, which also can be found in as in form of tablet, some oats, cereal, whole grain cereal. Some of these are also rich in phytoestrogen. Note that there is not enough evidence to support the use of this in people who have estrogen-dependent cancer, and we don't have enough safety data with regards to thromboembolic events, which include, DVT or pulmonary embolism risk of developing clots or heart attack or stroke in women. So it's important that women are asking questions and talking to their doctors when they experience this, and it's also important that we're more aware of these symptoms and act promptly. Also, there are some other over-the-counter remedies which we can find from the chemist, which the chemist can advise. The doctors also will be discussing various options based on your preferences and your circumstances. Overall, in general, women should take charge of their own health. They should be able to make more informed decisions with regards to their health, and ask questions as many times as possible. From the Nigerian community in Peterborough, I wish everybody, all women all over the world, happy International Women's Day, and keep being the queens that we all are. Thank you.